Welcome back to Around the Table with Brandon and Brigitte. On today's episode, we were joined by Dr. Ian Shtulman. Dr. Shtulman is a second-generation chiropractor specialized in prenatal and pediatric care. As a diplomate in Chiropractic Pediatrics and a faculty member for the International Chiropractic Pediatrics Association, he lectures on health topics throughout the country to both parents and healthcare providers alike. He's married to his college sweetheart with whom he has two boys, Aaron and Benjamin, ages 4 and 6 respectively. And on a personal note, he's a cool guy with really strong opinions. He's passionate about what he believes in. This was a joy for us, and we had a blast shooting the episode. We really think you're going to get something out of it, so let's jump right in. Thanks for being with us this morning, man.
Yeah, we're so glad you're here.
Yeah, I'm glad to be here.
You are a chiropractor, and
Guilty.
people have thoughts about chiropractors. But as we're getting going, I would love if you just share a little bit with us about your background, what got you into it, and what makes you unique. Because we found you because Brigitte was pregnant and wanted a chiropractor. Mm-hmm. So maybe you'll start with that.
Yeah, I never really wanted to be a chiropractor growing up, but I was under chiropractic care my whole life. My dad's a chiropractor, and he had at least the basic understanding of the value of chiropractic to have me under care from a very early age. Mm-hmm. And he wasn't really a prenatal or pediatric chiropractor like I am, but it was just something that, you're a chiropractor, you adjust your kids. Mm-hmm. And I grew up very healthy, rarely getting sick, rarely having to need any sort of medical intervention. It got to a point where I was so frustrated with my parents that I never got to miss school for being sick that they started giving me mental health days where I can just pick a day and say, no, all right, I'll stay home.
I didn't get those as a kid.
Yeah.
I did not get the mental.
And I was actually at University of Florida studying pre-med sort of coursework, and I really wanted to be an orthopedic surgeon. And I was driving up to school with my dad, and he put in a CD that he recently made to educate new patients on what chiropractic is. And it was the first time that I really understood the relationship between the structure of the body and the function.
And you're how old at this point?
I was 19. And I remember listening to that 20-minute CD, and it was very cheesy. It was The Magic in You by Dr. Howard Shtulman. And
So this is your dad's CD?
This is my dad's CD, yeah.
Okay.
Yeah. Back when, cars had CD players.
Absolutely.
And I turned it off, and I just said, how did you never tell me about this? Like you shared all these amazing stories of women who couldn't get pregnant, who started getting adjusted and suddenly were having children, people who were on the verge of suicide and they started getting adjusted and their life turned around. Like, how did you not tell me about this? He says, Ian, you practice for 30 years and you just come to expect it. And that was such a profound moment for me because I said, wow, how cool would it be to see these miracles every day in practice for 30 years and not even think twice about it. So I told him I wanted to be a chiropractor, and he said, yeah. Like, let me know in a year.
Yeah.
And
because you're 19, you'll change 20 times
exactly,
the next year.
Yeah. At that point, I wanted to be a meteorologist. I wanted to be everything.
Benjamin wants to be Batman, so we're good. Yeah.
Perfect.
Yeah.
Absolutely. So I just, that thought just kind of stuck with me. And I was going through all of my pre-med classes at UF, and I realized that the things that I was learning about didn't make sense in the context of how I was raised, right? And so we were, learning about in school about how all of these medications and surgeries and all that. And I said, I never had any of this. That there's something that's fundamentally missing in this conversation. And so the longer I talked with my dad about it, the more I realized that chiropractic offered something that bridged the gap between what our body is able to do and what it's actually doing. And that's when I fell in love and I decided this is what I was gonna do. Fast forward a couple of years, I was at Life University College of Chiropractic in Atlanta. And one of the first speakers that I heard was Dr. Jeannie Ohm, who's became a personal mentor of mine. And she was the executive director of the International Chiropractic Pediatrics Association. She spoke so eloquently and passionately about the role of chiropractic in supporting pregnancy and birth, postpartum pediatric care, that 30 minutes later, I said, this is what I'm going to do for the rest of my life. And that's what I did.
That's awesome. And yeah, because I found you, I was 20 something weeks pregnant with our first, and I was having such bad back pain. So I had a friend that went to you, and she referred me. And I was like, all right, it's a little bit of a drive because we were like 25 minutes away. But I was like, I'm going to go. And through that, I mean, it was like after the first couple, and I didn't have any pain anymore.
Yeah.
And like since then, I've been a big fan. Took him 5 years to go, but whatever.
We're gonna get into that.
Men are always the last.
But I love what you said about like what you saw versus what you had experienced, and what you were learning versus what you experienced, and how there's such a gap because being in the medical profession since I was 18, now I'm 36, so I see the other side, and it's just so medical, and it's like, but what about the other options, and that's what I really love about being under a chiropractor. And then when I was in an accident, being able to go right away because we already had a relationship, and just how much that helped. And so I love that side of it, but it's still medicine.
I think the big problem is if you look at medicine as an industry, it's very much focused on the diagnosis and treatment of disease using primarily drugs, radiation, and surgery. And there are times when it's absolutely essential and life-saving. But for the most part, a lot of what we experience in our daily life is not pathology. It doesn't cross into that realm. And they don't really get proper training on nutrition and mindset and physiology as far as exercise. And so there's this big gap between, hey, my health is less than optimal, but it's not quite at the point where it's pathological. What do I do? And there's not very many options within the industry of medicine to support that space. We find that some of our best patients, nurses, medical physicians, rad techs, ultrasound techs, people who are in that field every day and recognize there's something fundamentally missing from the healthcare conversation in this country.
Yeah, I agree.
Well, when she started going to you, and I'll just lay out, like, I came from a very skeptical standpoint of this, right? Like, not in a, this is garbage, but in a, I don't know it, I don't know enough about it, I want to know about it, so I don't trust it. And I thought there was probably, in the onset when she started going, I thought there was probably some help with her back because she was pregnant, and I was so glad for that. Like, I was super happy that she was finding relief.
Yeah.
And I thought there was probably some combination of relaxing the muscles, relieving some tension, and some placebo effect, right? Which, like, I'm super happy for. And that's not to knock the placebo effect because it's legitimately medically viable.
It's the only medical intervention that has stood the test of time.
Right, yeah. And so for a long time, I didn't go. And I did some research. And whenever I talked to you, I didn't get like a quackery vibe at all. You know what I mean? We talked about that before we got going there. But I was still really skeptical.
Yeah.
I ended up with a back injury. So I finally went to a chiropractor, not you, because I went to a guy down the street from my job. And it was horrible. And it was a chain thing. And he just put me on the table and started going to town. And my back was in such crazy spasm because I had a bulged disc between L5 and S1 that just hurt constantly. I could barely move. And he just starts like, cranking on it. It was bad. Took me a while. I finally went to you. And we'll get into my experience from that, the relief I found. But man, when I started going down the rabbit trail when she first started going there, I found some things that I think anybody who does a quick Google search would be like, oh, that's concerning. Now, you can find that about anybody, right? Sure. You can find out about the history of anything. You look at the history of our country, we got some stuff, right?
We do.
Right. So, like, in the history of chiropractic, there's some stuff. And anybody who's watching this, right, because a lot of our audience so far is families, moms, dads who are trying to find the best thing for the health of their family. And they're like, chiropractic, I don't know, I've heard some stuff. They Google, they find the Wikipedia articles about Daniel David Palmer. Man, could you speak to that a little bit? Like, tell us what you know.
Yeah, so you have to understand, I mean, we're talking about the late 1800s, right? Medicine was the wild, wild west. Nobody really knew what they were talking about. The scientific method hadn't really been established in the terms of healthcare. This was the time where there was still, leeching and bloodletting and all sorts of stuff that we think about now and laugh about.
We're not supposed to do leeching anymore? Is that?
Well,
it's frowned upon.
And so D.D. Palmer was in Davenport, Iowa, and he was at the time a magnetic healer, right? Something that right now we look at with skepticism, but at the time, wasn't really all that wild. And there was a man that worked in the building on Brady Street, and he he basically was hard of hearing, and he described how years earlier he hit his head and slowly lost his hearing over time. And D.D. Palmer had this idea that, maybe you knocked something loose and that was getting in the way of your hearing. And so he basically felt around his neck and he found a lump, something that felt like it was a bone out of place. And he laid him down and he adjusted him, delivered the first force to restore normal motion to the spine. And gradually Harvey Lillard got his hearing back. And so originally, you think about chiropractic, it was advertised as almost like this is a cure for deafness.
Right.
He didn't have the structure or the philosophy to really understand what he was doing. He didn't even have the science at the time to understand what he was doing.
Anatomical science was super
Absolutely.
early, yeah.
And so he started advertising. He started seeing all these people who came for their hearing. And they didn't necessarily get the hearing restored, but they noticed their quality of life improved. They noticed their heart condition got better, their digestion got better, their stress levels, like all these other things. So that's when he started saying, all right, well, what is it that I'm actually doing here? And what he discovered is that, and this kind of started down the route of chiropractic as a quote unquote pseudoscience, because the science wasn't developed at the time. D.D. Palmer talked about life is founded on tone. Right? And if you go down to the smallest subsets of an atom, what do you see? You see vibration, right? Well, vibration tone, that stuff that's what creates life. That's what creates us and holds us into existence. And so D.D. Palmer said, if this tone is off, it's going to create dysfunction in the body. It's not going to allow the body to work as well as it's supposed to. And that was the very kind of foundational approach to chiropractic. His son, B.J. Palmer, ended up taking over the school a few years later, and he had this idea where it was a little bit more structural in nature. That, long story short, if a bone shifts out of position, it disrupts the nervous system, and that nervous system can't regulate the body as well as it's supposed to, and it leads to all sorts of issues. It's actually a very simple concept, and I think in some ways chiropractic is hurt by its simplicity. When you think about healthcare, you think about, that is an advanced study of the body that only special learned people can ever access. And we get so caught up in some of the detailed science about it, we forget that if the structure is off, the function is going to be compromised. Right? This table, if there's something off about the structure, it's not going to work as solidly. We think about that in terms of our car and the alignment of the tires. We think about that in terms of so many areas of our life except our actual health and physiology. So what chiropractic is really founded on is the premise that when your spine and nervous system are working well together, it allows your body to work better.
So you would say, to cut you off? No. So you would say that, so, I hear what you're saying. D.D. Palmer said, well, it's the tone, vibration, right. Yeah. So in my head, when you're speaking, what I'm thinking about is early medical or pre-medical understandings of like ill humors and miasmas and things like that. And miasma is a real thing. If you say what it means is there are bacteria and viruses in the air. Right? The Black Plague came from miasma. No, you were coughing on people, bro. Why
We're talking about terminology that was created by the people of their time. Right. And we look back at that terminology and we try to use it as ammunition to debunk or shoot down their statements, not realizing that they were talking about things that hadn't been mentioned before. Limited understanding. I mean, B.J. Palmer was one of the first people to have an X-ray machine west of the Mississippi. Oh, wow. He was the first person to really look at the body and say, look at the structure on X-ray. I mean, we're talking about people who created the science. We're talking about people who discovered things that medicine now is validating. Decades, over 120 years later, validating the science that D.D. and B.J. talked about. And now you're starting to see medicine branch out into what some would refer to as like metaphysical concepts, right? Yeah. That was mocked for decades. And I think that's where chiropractic got placed into this kind of a label of quackery, according to the American Medical Association, that when you look back and you realize that those foundational premises that Dee Dee and BJ talked about are the ones that are being validated by science today.
Well, and it's, it gets back to this idea of what is now today bandied about, this term settled science.
Oh, gosh.
As if like that makes sense in the scientific method
It's
in
a
any way, shape, or
contradiction.
form. Right. So like we have this idea of settled science, but man, we've talked a little bit about some of the health things I've found and may have been aggravated by medicines that are safe and effective that I've been taking for 20 years because it was settled science. But that's not the case. So we go back to Dee Dee Palmer. I want to push back one more thing there, just because, man, my quick Google search, here's what I find on Wikipedia, and this may not be a big deal, and maybe you know about it. His daughter tells a very different story from what I read of the account of events with that. I don't know anything about their relationship or any of the history of that. Do you know about that controversy? And can you say anything about that? Like, she says the guy, her dad, like, hit him with a book in the back of the head or something.
I think the problem is you're talking about a time that doesn't really have established medical records. And you're talking about people who are still in this experimental phase of discovering what it was. The reality is the only people who know what happened in that room were Dee Dee and Harvey. And there's no doubt a level of storytelling that goes involved in these sorts of things that gets a lot of myth and a lot of things that gets kind of created over time. So I don't think we really know exactly what the case was, but we can look back at some of the earliest writings of Dee Dee's journal, of BJ's journaling, and even some of the statements that Harvey Lillard, wrote about before his death, and talk about and say, like, yeah, the general tone of the story is true. Whether it was he hit him with a book, or whether it was he laid down and said, "Let me adjust here," we don't know what the original moment was. But what we do know is the effect, that a restoration of normal biomechanics in the spine allowed the physiology to return to normal, and ultimately, symptomatically, his hearing was restored. How that happened, what was the specific mechanism, we can talk about the science and what causes that, but at the time, we didn't really know. And so it's interesting to see how over time we're trying to discover the truth of what that actually story was, but
yeah, I mean, I want to come at this in a not critical, but critical thinking type of way when I'm asking these questions, because I want the people who are listening to not be like, oh, well, what about this? You know what I mean? Like, let's talk about them. So I don't want to like just be beating it all up. Also, I should say, like, for us, like, our whole worldview is based on the idea that a guy literally came back from the dead. So, like, to say that there are things we don't understand about the body, yeah, I can't knock that, right? So let's take it into modern day, right? Let's take it into what you practice. You're talking about biomechanics. You're talking about BJ Palmer having identified there are structural things going on there that affect the body. I'd love to get into the mechanism of it, how you believe and how you've seen these things affect health in different ways. And I know you talked about treatment and response versus like prevention. But to get into that, I think also valuable, what does chiropractic do and what does it not do? What can it do? Because this is what people I think get scared of. Like, oh, this chiropractor said if you cracked my back, my cancer would go away, right? And I heard you say to me one time, I mentioned cracking my back, you're like, crack is whack. That was cheesy, and also it made me love you, okay? So tell me...
Every once in a while I quote Whitney Houston.
Yeah. She made up her mind. I'm proud of her. Yeah. But what makes crack whack, but also what can chiropractic do and what can it not do?
So it's important to understand that there's, in some ways, a difference between what chiropractic is traditionally and how it's practiced in many offices today. Sure. At its core, chiropractic is not a treatment for any sort of sickness, disease, condition. At its core, chiropractic is about the restoration of normal neurobiomechanics, allowing the structure and the nervous system to work properly together to allow the body to constantly perceive, adapt, heal, coordinate, do all that, regulate all of the normal function that it's supposed to do, right? So long story short, when the spine or pelvis shifts it creates disruption to the nervous system. That disruption makes it harder for the body to do the things that the body needs to do. Now, if that manifests in young children, breastfeeding issues, colic, reflux, constipation, torticollis, developmental delays, all sorts of things like that. In older kids, chronic ear infections, allergies, asthma, neurodevelopmental delays. In adults, migraines, excess stress, poor sleep, etc. Now, chiropractic isn't a treatment for any of those things, but chiropractic can allow the body to work better so the body can function normally, therefore those things don't manifest or the body's able to heal and recover. So chiropractic is much more about facilitating normal healing and not treating a specific condition or symptom. That's different from how some chiropractors practice, where they want to position chiropractic as a treatment for musculoskeletal pain. And the reason that happened is honestly because of insurance reimbursement. Because insurance said in the 70s and 80s, all right, yeah, we'll cover chiropractic. And then gradually over time started to decrease the number of diagnoses that it would cover and the number of visits that it would cover. And so gradually a lot of chiropractors, in an effort to stay relevant with insurance, became more and more focused on musculoskeletal conditions, and in an effort to try to gain acceptance with the broader medical community, said, look, we'll just talk about musculoskeletal symptoms if you like us. Whereas traditional chiropractic, we talk about the body has an immense healing potential. The question is, what can we do to allow the body to express that fully? And we've seen some amazing things in the office. You know, of course, there's people who feel better after aches and pains, but we also see people who are stuck in labor with no signs of progress, with baby not dropping, with the pelvis not opening up, with the uterus not contracting. And we go in and we make an adjustment, and all of a sudden, baby comes out. There are times when babies are in a state of failure to thrive, where they're not gaining weight, they're not eating. Medical physicians are just completely confused as to what to do. We deliver a gentle adjustment, and suddenly that baby eats for the first time on their own. We see people who are ear infection after ear infection after ear infection, and we deliver an adjustment, and the body's able to work better. The eustachian tubes are able to clear. The immune system is able to respond appropriately, and suddenly that child no longer has ear infections. And we can go through. I mean, there's so many stories. I've had one where a mom told me she had 2 kids, and after a series of adjustments, I said, "What have you noticed that's different?" She got choked up, and she said, "I like my daughter." So, what do you mean by that? She goes, "For years, I focused on, I was always a good mom, right? But I never enjoyed it. I never enjoyed being with her. I never had fun with her. And I've always felt resentful toward her. And since I started getting adjusted, I've noticed that I actually enjoy being with her. That I've not just loved her like a mom, but I've actually enjoyed being around her and spending time with her, and it's completely changed our relationship." Now, it's not that there's some magical loving my children adjustment. It's that when the body is able to work more efficiently and better adapt to the stress that we put ourselves in throughout our daily life, our body is able to respond and create the relationships or the function that we want, that the body's always been capable of, but was never being able to fully express.
I think some of the things you said,
Yeah. Well, and what I love, because I have always loved biology, the body, learning how everything works together. That's why I got in medical fields. And so I love, even in your office, there's posters about how, it shows the body, it shows all the nerves, at what level they come off, what they go to, what they're responsible for controlling. And so to me, I'm like, oh, that's awesome. Like, because I've been feeling, this kind of problem, that's probably about that level. So, I'm able to express it, and you're able to help narrow it down to where my problem could be. And so, from my perspective, I really love that science behind it, because it's not just like, oh, let's just do everything on your body because that's what we do and that's your whole session, And
I think what's important is you'll notice there's some times where people come in and they have a symptom, but they don't even mention it. And then I assess the spine and I find an area that needs to be adjusted. And you look at the chart and you're like, oh yeah, it actually correlates to some things that I've been experiencing. the body has this tremendous capacity to heal and coordinate normal function. The key is to let it do that. The key is to allow our body to do what it's always been capable of doing, but has been struggling to express. And chiropractic is just one piece of that, right? I say that there are 5 aspects of, health and wellness. You have to eat well, move well, think well, sleep well, and have a well-functioning nervous system.
Can you say those again for everybody?
Sure. You have to eat well,
Okay.
move well,
Okay.
think well,
Okay.
sleep well, and have a well-functioning nervous system.
I do one of those. That's good.
The thing about it is, imagine that is like the spokes of a wheel, right? The ability of that wheel to rotate smoothly is going to be dependent on the equal length of all of those, right? And if you have one that's off, no matter how good your quality of your lifestyle is, if your nervous system isn't functioning normally,
You're living with a limp.
you're living with a spoke that's not as allowing the whole wheel to work as efficiently as it should.
Yeah, so I mean, you've got a doctor for everything, and they don't communicate it, and I clearly see that because one doctor will order a renal ultrasound, and literally then the nephrologist will come in and order it again, and I'm like, did you not just see we did it like 2 hours ago? I mean,
Yeah, medicine operates in a reductionist mindset. It's let's break down each piece of the body into the smallest component and have somebody who really just studies that to a degree that nobody else understands it.
Yeah.
The problem is the body doesn't work in pieces.
Right.
The body works as the sum of all of its parts, right? More than the sum of all of its parts, to be honest. And the problem with specialization is that, especially in healthcare, a specialist is somebody who knows more and more about less and less until they know everything about nothing. And they lose the greater picture, right? They don't understand that digestion is going to be intimately connected to the nervous system. And they don't understand that your reproductive function is going to be compromised by your lung function. They don't understand how all of these different pieces work together. And I think the problem that we have is that we look at all of this disease and pathology from an idea that it exists within one organ system, and it doesn't.
no, they're so interconnected.
Everything is interconnected.
Well, if I've got a problem with my sink, I'm not going to be like, oh, well, the rest of the pipes are totally fine. You know what I mean? Like, I'm going to look around at the rest of the pipes.
Yeah, I mean, you'd hope. But the other question would be, all right, well, how does the foundation influence your plumbing?
Yeah.
How does your electrical system potentially affect the hot water heater, right? How do all of these things blend together? And I think the problem is we spend so much time trying to analyze one system, not realizing that all of the other systems have at least some influence on it. If we were going to go to a house analogy, you have, from a chiropractic perspective, the pelvis and the lower part of the spine, what all of the structures is sitting on, is the foundation for the house. But the upper part of your neck, where the brain sends signals down to the rest of the body, is like the circuit breaker, right? With the spine dividing out the nerves to all the different parts of the body. You can have an issue in either of those parts, and it's going to manifest somewhere else, right? If the power goes out in your bathroom, you're not going to just replace all the outlets in your bathroom and think that that's the answer, right? You're going to go over to the circuit breaker and say, all right, did something flip?
Right.
And is there a problem there that I can just correct in order to let the entire room work better? Right. But we spend too much time looking at the sagging ceiling and not looking at the foundation to understand the cause of it.
That makes a lot of sense, man. And I like what you're saying about the holistic approach is kind of how you said it, Brigitte. I know that term gets bandied about a lot in a haphazard manner. So I get that, not wanting that to be the thing. But you said something before we had the quick break there that I think is really important for people to hear. And I heard it and I was like, I think that's the message people need to hear. And then we can go from what it isn't to what it really is and how it can be valuable. You said something like, and don't let me misquote you, chiropractic doesn't treat disease. And I heard then what you said. Everything you said after that was super valuable. But I think it's so important that we hear that, because I think that's what people are afraid of, right? They're like, it doesn't make sense to me that your adjustment is going to treat my son's ear infection because that's caused by bacteria, right? And you're like, I think your response to that would be something like, yeah, but if the eustachian tubes can drain better, that will prevent the buildup of bacteria. Is that kind of what you would say?
Yeah, I mean, in the case of an ear infection,
As an example.
if the upper cervical spine is compromised in its biomechanics, it's going to pinch off the eustachian tube, causing fluid to build up in the ears. Stagnant fluid breeds infection. It's going to compromise the immune function, and so you're going to have a body that is going to be more hyper-responsive, creating chronic inflammation and chronic infections. And you're going to have a body, especially with treatment of antibiotics, that is going to slowly destroy the necessary bacteria in the body that actually helps us stay well.
And 15 years ago, if you had said, oh, the gut microbiome is so key to your health, I think that most MDs I know, at least maybe not all the DOs, but most MDs I know would have gone, yeah, that's garbage. What you need is cholesterol medicine or something like that, right? But I think now it's become such accepted science that the microbiome like runs our brains.
Yeah.
So again, not settled science.
There's an interesting YouTube video, and maybe you can find it and link to it, but it talks about the wolves in Yosemite. And it talks about how when they hunted the wolves to near extinction, it allowed the deer to graze beyond their normal habitat, which then tore apart the plains and it diverted the rivers, and it led to all of, I mean, you go down all of these issues. And then when they introduced the wolves back in, all of a sudden the ecosystem returned to normal. We have to think of the body as its own self-contained ecosystem that is constantly interacting and adapting with the world around us.
It isn't just made up of us, the organism.
No, we have, I mean, some estimates say 100 times more bacteria than human cells.
Right.
So how can we possibly think that we're going to disrupt that ecosystem and make it better?
Right.
It just doesn't happen. You can't remove an organ. You can't medicate the body and disrupt that ecosystem for the better. You can do it to help save lives. You can do it to help protect people in an emergency.
Well, you can correct it perhaps if it's off to make it better.
Well, you know, here's the
But then you've already heard it with food, which is medicine that's bad.
Yeah, so think about it from this perspective. Going back to the house analogy.
Yeah.
Let's say your house is on fire.
Prefer not to, but
you're not gonna. Yeah, well, you're not gonna call the carpenter
Right.
or the contractor to come in and put out the fire. You need to put out the fire. You're gonna call the fire department. They're the ones with the hoses and the axes. They're gonna knock down the doors. They're gonna spray everything down. They're gonna put out the fire.
Yeah.
But you're not gonna call the fire department out the next day to spray down your house again in order to make the house work better, or in order to help the house recover, or in order to make the house livable again. You need to call somebody else. Because those people, the carpenters, the contractors, they have the tools necessary to dry out the house, to protect it from fires, to allow the house to be livable again, right? You're grateful that the fire department is there, and you need them when you do, but you're not going to rely on them for everything. The problem is we rely on the fire department for everything in healthcare. We look at the strongest interventions, drugs, radiation, and surgery that should be the axes and hoses, and we think that they're the nails and wood necessary to rebuild our homes after we're already in a fire. It's not. And so what you have is people who are living longer, but they're living sicker than ever before. You have more chronic illness.
we can keep you alive while you're sick,
Sure, yeah.
but you're sick.
Yeah, I mean, listen, you know, there are people who are going to say, oh, it's the effort of big pharma to try to keep people sick and customers for life. I don't think that cynically. I think that what we have is a system that is fundamentally flawed from their philosophy. The philosophy is just off. It's based, yeah, it's based on the idea that the body is nothing more than a bunch of different parts, and that those different parts, as long as we can keep them working within a mild range of homeostasis, then that's going to allow the whole system to work better. The problem is when somebody passes, when somebody loses their life, all of those parts are still there. They have the same blood, they have the same organs, but there's something in vitalism we talk about a life force. In chiropractic we talk about innate intelligence. In religion you might talk about the spirit. But what you're thinking about, there's some other entity that is no longer there that animates the internal living world, as B.J. Palmer wrote in a poem that I love. That there's something there that allows that body to exist. And if we want to have a different analogy, if you got into your car Your car is a bunch of different parts, right? They all work together. And if one part isn't working, the whole car is going to suffer. But the car doesn't move unless you get behind the wheel and start driving. So in chiropractic, we talk about the innate intelligence, the inborn wisdom of the body to be able to know what to do and how to do it. And that's actually, that philosophy is something that gives the body some credit for the healing and health that it creates. Whereas medicine, it's very much about what can we do externally to try to allow that body to work better, not at all giving credit to what the body is actually doing, which is the healing itself.
So what do you think, because I see a lot of patients too, obviously, for ultrasound. What do you think, is it education? Is it just misinformation? Like people come in like, oh, I have this problem, let me fix this. But then they're always in for the one thing and never looking at like, how do we inform them? Like, what is it that you think holds people back?
We have a system in at least in the U.S., but honestly, the entire Western world, that is very crisis to crisis, right? It's very focused on what is the problem in the moment. And let's be honest, our government does the same thing, right? Let's address, I mean, not to get into politics,
Dude,
but
our family does the same thing. But
yeah,
totally.
Of course. I mean, listen, that's how most people do things, right? I mean, listen, even my house, right? I'll fix things when they stop working, right? Instead of actually doing regular maintenance. The difference is I could always move. I can always get a new house. I can always, no matter how badly damaged my house is, you can almost always repair it if you're willing to spend the time and money. You can't say that about the body.
Right.
And the way that I like to describe it is, we have, as I mentioned before, this tremendous ability to heal, but we need to give it the fuel, the tools, the information, the connection to be able to do it. You can't do that when you've already progressed so much to a point where the body is in distress. Right. It's proactive. You need to eat well, move well, think well, sleep well, and have a well-functioning nervous system from a very early life in order to allow the body to develop and grow and learn and do things that way. Because here's the thing is when people end up with symptoms or disease, when they develop a condition, their body has been struggling to adapt for so long that they've created a physiological compensation that we can then identify and say, oh, this is a pathology, right? It's not that it just suddenly popped up one day. It's the result of a combination of genes and lifestyle and failure to adapt. And they get to a point where the body is no longer working as well as they need to. And then we say, all right, let's go identify if we can remove something or if we can medicate something to suppress the symptom.
And not to knock medicine. Like, I want to be clear, for me at least, I'm so glad we have medical science. I'm so
100%.
Right?
And that's not the conversation.
No.
The conversation is the fire department being used appropriately?
Right. And I think so often, and even before I was seeing you in your practice, like, I think it's clear to me, and I know it's clear to every doctor who has any medical knowledge at all, our drugs and our interventions and even surgeries do not heal the body. No. The body heals the body, sometimes with the aid of intervention. Absolutely. A cast doesn't fix my broken arm, it allows my arm to heal itself.
Absolutely.
Right.
So what you're saying shouldn't be, on its face, the way you're explaining, shouldn't be a controversial idea. Why has it been? Why has there been so much controversy, and why do we still have such a stigma? And I do want to ask more specific things about kind of your practice, why you focus on women in pregnancy and on children. I'd like to hear more about that, and definitely about the pregnancy thing. You just had some stuff in the break. I want to hear more about labor and delivery. But why have we know this? Why have we know that it's not we that heal the body, but the body that heals the body? Why does this sound like quackery to people, to use your word?
I don't think people like to take responsibility.
I was literally just going to bring up, what's the role of the patient in this? Because I feel like, and maybe you can speak to this too, but people just want a quick fix. They don't want to change the way they eat. They don't want to exercise. They don't want to put in the effort to put themselves in a position where they can see you, you can align, and their body can then help heal itself.
I don't know if either of you have ever heard me say this, but when people come in and they say, oh my God, I'm so much better, thank you so much, I say, you did the healing, I just moved the bones, right? Because to me, I have this philosophy of take no credit, take no blame, right? My job is to restore normal neurobiomechanics to allow the body the best ability to do what it's capable of doing, right? To heal, to function, to regulate, to adapt. But I'm not responsible for how you live your life outside of my office. I'm not responsible for the choices in what you eat or how you move or how you think. That's not my job. And so when people come in and they say, oh my gosh, I just had COVID and it was nothing. I had no symptoms, right?
You're probably healthy.
Well, I look back and I say, okay, cool. Celebrate the things that you've done to set yourself up to have those symptoms. And then people come in and they've had really bad experiences with COVID. And I say, well, listen, one, celebrate the fact that your body was able to do enough to stay alive, right? And function as well as it did. And be grateful that medical intervention is available to support us in that process. And hey, that's some feedback. Your body's telling you that there's something that you can do to get better in the future.
Well, I think there's an honesty thing here, man, because, I was thinking the COVID thing as soon as you said that too, like it's about your lifestyle and the choices you've made, and you've got to take credit for that. When I had COVID, not to get us knocked off YouTube or anything, but when I had COVID, I had pneumonia. I had COVID pneumonia. And I went to the hospital because I was concerned. I could not breathe well.
Yeah, your house is on fire.
Right. It was bad. But you know why it was bad? Because I'm like 33% BMI. That's my choices. That's my fault. And it never occurred to me to go, oh, the dang COVID done me in. It didn't. One, thank God for the monoclonal antibodies. That treatment works super well for me. Like, love it. Great. But it knocked me out for a while, man. Yeah. And I knew that has to do with my choices. Do you see a lot of, like, I know the choices I make, and I know when they're bad. Our education system is good enough for me to know what I should and shouldn't eat roughly. And I do it anyway. That's my choice. Do you see a lot of people denying that in your practice? Do you see a lot of people saying not taking responsibility?
I think there's a lot of people who like the idea of responsibility, but don't want to have to sacrifice any of the things that they're used to enjoying. They love the idea of working out, but they don't want to wake up early to do it. They love the idea of eating healthy and letting food be thy medicine, right? Yeah. But they also want the convenience of a drive-through.
Yes.
And that's not judgment. That's not coming from a place of judgment. I mean, listen, as much as I grew up getting, as long as, I grew up getting adjusted, but I also grew up going through drive-throughs, right? It was also a time when we didn't know as much about nutrition and physiology. But what we find is that it's hard to make choices on a regular basis. It's easy to have a salad for one meal, but it's hard to get yourself to say, I'm going to choose this day in and day out, because the body takes time to heal. There's a chiropractic principle that says there's no process that does not require time. And when you change your physiology, your lifestyle, there's a couple things that you notice. Your cells, as they're replaced naturally, they get replaced with healthier cells. The healthier cells, when you get enough, create healthier tissue. More healthy tissue creates healthy organs. And that's what allows the body to heal and recover. The other thing that you notice is actually really interesting. It's called epigenetics. Epigenetics is the field where your lifestyle influences the expression of your genome.
And this is real deal. Like, this is not, this is like not a chiropractic thing.
No.
Because they are finding that, like, smokers have mutated DNA being passed on to their kids.
Yes.
Like in your sperm, in your eggs.
If you look at people coming from like South Pacific Islands, they come to the US with no history of cancer, diabetes, despite being typically overweight. Sure. Within one generation of the American lifestyle, within one generation of the American lifestyle, their kids are more likely to develop cancer, diabetes, So we don't understand sometimes that our lifestyle will change our genome. A great example is when they had the potato famine in Ireland. What they found is that the absence of nutrition during pregnancy and infancy led to that generation of children being more likely to store those starches as fat.
That's so interesting, but it makes perfect sense.
And the body is, here's the thing that I love about the body. The body is so unlimited in its wisdom, right? It's always going to adapt as well as it can, given the environment that you're placing it in.
But sometimes those adaptations have negative outcomes.
Listen, when I had bad sushi and I spent the night throwing up and having diarrhea, I thought that was a bad outcome, but the reality is it was my body doing exactly what my body needed to do.
And it hurt you.
Oh, it was awful.
But it also saved you.
Yes.
Yeah.
The thing is that we can't think about our health as how we're feeling, because my mom felt great until her heart attack.
Yeah.
Right? Overwhelmingly, death is the first symptom of heart disease. Right? So we need to think about what's happening in our body. I mean, all of us, every single day, are developing cancer cells in our body.
Yeah.
And we have an immune system that is focused on isolating and eliminating. So the question is, what is it in some people that will allow those cancer cells to evolve into a diagnosable condition? Better yet, my wife had concerns about a BRCA mutation because her mom had breast cancer at an early age. And we met with a geneticist, and my wife was considering getting tested. And the geneticist said to my wife, 80% of women with a BRCA mutation get cancer at some point in their life. So I kind of raised my hand, which always makes my wife cringe. And
She knows how this feels.
Yeah. And I said, what's different about the other 20%? And the geneticist said, what do you mean? I said,
somebody asked that question?
I said, what's different about their lifestyle that does not activate that cancer gene to manifest?
Wouldn't that be the better question to ask anyway?
I think so.
And epidemiological studies are not going to give you that because they haven't been focused on that.
And here's the thing, science is great, but science is only as good as the questions you ask.
Yes.
Philosophy asks the questions that science then answers. And what we have is a flawed philosophy, even in chiropractic, by the way, because most of the people who control the money that goes to research are asking the question of how can chiropractic help musculoskeletal pain, because they're operating from a one paradigm philosophy. In healthcare, we have a one paradigm philosophy. The question is, right now what we're seeing in research is, what treatments can we give to people to help with COVID, instead of what can people do in their daily life to help increase their resistance to COVID and help their body better adapt to the world when you're eventually exposed.
Because that's the thing that I saw is that people were like, oh my gosh, you were exposed. I'm like, yeah, but I have an immune system still. It doesn't mean I'm going to get it. And I had multiple known encounters of COVID before I actually got it that, came back, whatever, because they were much more tracking it all in the hospital. And I never got it.
Yeah.
People that were with people that were crying all over them because of a miscarriage that then they found out had COVID, a day later, contacted all the people that they never got it because they still have immune systems.
I mean, I would even venture to say it may not even be a question of if they got it.
Right.
It could be that they were exposed and had an immune response that was so efficient they never manifested symptoms. Because I've been taking care of COVID patients since the beginning of the pandemic. Because of the effect chiropractic has on the immune system and the fact that I've made a commitment to my patients that I will always take care of them the way I take care of my family. I have said, if you have COVID, let me know. Come in during lunch, come in at the end of the day. I'll take care of you when it's just us in the office, and it'll help your body get better. And we've had people who get their smell back or their taste back or are able to breathe better after an adjustment. But despite all of this, I'd never really gotten sick. And so at one point I said, you know what, let me go and get tested for antibodies to see. And sure enough, I had antibodies. Yeah. So at some point I was exposed and developed an immune response. And I think what happens is we like to dismiss that as luck. Very little of our health is as a result of bad luck, bad genes, or bad germs. It's always a result of our body not being able to adapt as well as it should or could.
Yeah, I mean, I guess paper is flammable, but if you don't put it in a fire, it's not going to catch on fire.
Absolutely. And, that paper becomes more flammable if you let it soak in kerosene.
Yeah, absolutely.
I mean, the problem is we have a lifestyle that has us soaked in kerosene, right? And then we're constantly hovering over a flame saying, please don't catch on fire. Oh, shoot, such bad luck. Well, you kind of put yourself in a situation where you're far more likely to have it. And again, that's not a judgment place. I think it's a place of we need to change the mindset around our lifestyle from a very early age. It can't be wait until something goes wrong and then change your lifestyle. It has to be let's develop a lifestyle that our kids recognize as normal for them.
And you feel like chiropractic is an important part of that lifestyle.
If you have a spine. I mean,
It's like mechanics are important if you have a motor. Is that what you're
yeah,
saying?
yeah. I mean,
Yeah.
you know, it's like, you know, you're not going to ask a surgeon, do you think having a sharp scalpel is important?
Yeah.
Right? Because the sharp scalpel is one of the important tools that allows a surgeon to do their best. Your spine and nervous system is one of the most fundamentally essential tools. You know, the nervous system is the first system of the body that develops in embryology. You can't have a body that's working properly if the nervous system isn't. You know,
and how it's so connected to the
yes.
spine.
And it's like we'll break a kid's legs and reset them to fix bow-leggedness, but what do we do about the spine as you grow and develop?
Yeah, well, we focus on the cosmetic component of
Right,
it.
yeah.
We focus on scoliosis because of the curve it gives, and we focus on scoliosis because of the impact that it might have pinching off the organs. But we don't focus on scoliosis as far as how it's affecting the nervous system and how that nervous system is affecting this child's immune system, emotional development, sleep, digestion, reproductive function. All of these things are intimately connected to that same spine, but we don't look at it because we're so focused on pathology.
And they're well known that those are effects of scoliosis. By and large, I've heard those effects that you're talking about. And we test for it. I remember, at least in the state of Florida, in 7th grade, you go to the nurse and they check. They pull up your shirt, you're straight, go. Pull up your shirt, you're straight, go.
You have to bend and touch your toes.
Yeah,
I
but
did
it's
that in
like,
elementary school,
right,
remember?
okay. They check for it for the reasons you said, but they don't ask about any of the things you mentioned. And so if you have a mild curvature, they go, oh, it's within the margin, you're fine, go ahead. And I've never thought about this, but there's zero care. It's not that the nurse doesn't care, but she's got a machine to run. She's not there to help care for you holistically. She's there to see if your spine is bent enough for insurance to pay for it, right? And so it's like another one of these healthcare machines. And this affects our kids. And I'm thinking, okay, well, Benjamin, I just got a straight back because we bathe him and stuff. But like, as he gets older, what am I watching for? Well, also he visits you sometimes, so that's probably helpful. But kids are affected by this. And your practice, Shtulman Family Chiropractic, right? That's the actual name of the company. Yeah, okay. Why Family Chiropractic? Why does that matter? And I'd love to hear more about your passions for kids and women's health and things like that too.
You know, I fell in love with pregnancy very early on. I have a copy of Life magazine from 1965. It's the first color photos ever taken inside of a womb. And it shows the developing baby. And there's one photo or one page where there's a photo of sperm that are all swimming in the same direction. And there's another photo where they're swimming in all sorts of different directions. And the only difference between those two photos is the presence of an egg available to be fertilized.
Oh, that's interesting.
That these little half cells of genetic potential have the intelligence, right, to know where to go, how to get there, what to do when they do get there, and when to even try, right? And that half cell joins up with the egg, another half cell, to create one single human cell. And that cell divides and divides and differentiates, forming the heart, the lungs, the immune system, and the nervous system to facilitate all of it. And this idea that all of that happens inside of a body without you even having to think about it, right? That you are able to bring that life into this world, nourish that life through your own body, be able to do all this without even having to like go to school or understand the process. Like that's the embodiment of the innate intelligence that I was talking about, right? Yeah. And so pregnancy and birth became the best example of this innate intelligence that I just fell in love with, that I said, oh my gosh. And then when I learned that chiropractic can improve the quality of life in pregnancy, that can improve the physical comfort, like you mentioned, but it can also help get baby in a better position. That could help relax the uterine and pelvic floor muscles. That can create a better internal environment for baby as they develop. That facilitates an easier birth process, a faster recovery postpartum, that helps baby breastfeed and helps baby go to the bathroom and be more comfortable. I mean, these are the building blocks of family union. And the idea that chiropractic has some influence on that, I just became enamored with it. And I said, that's what I'm going to do for the rest of my life.
So how does chiropractic have an influence? You know, we're talking about a pregnant woman, and you mentioned specifically a woman in labor, I think, right? So how does that, because I think I'm like, okay, I'm tracking with you. You're talking about alignment of the spine. You're talking about proper function of the nerves, and this is affecting contractions and letting down and all this. Is that, am I following you right there?
So there's a couple components, because we can talk about the structural component of it. If the pelvis is not moving properly, it makes it harder for baby because babies don't just drop through the pelvis.
Right, that thing's trying to separate.
Well, and babies corkscrewing through. The shoulders are wider this way, the head is wider this way. And so what happens is baby drops down, the head drops down, and then they rotate 90 degrees and the shoulders drop into the pelvis. Then they rotate 90 degrees and the head comes out. Then they rotate 90 degrees and the shoulders come out. There's a rotational corkscrew component to it.
I remember this. I'm thinking about watching her give it. I'm like, okay, yeah, I got you. Yeah.
Well, if you
I never
notice-
saw that.
I'm thinking watching the hands go like this. Yeah.
Well, here's what happens is if you ever look at a natural birth, the head comes out and then there's a pause.
Yes.
And they're waiting for the shoulders to rotate. Now, the shoulders do that on their own. You don't really need a provider there manipulating baby's neck.
But I do see them doing that.
They do, and that's actually the cause of some of the first trauma that babies experience in life.
Interesting.
Because here's this baby, right? Explain to me how, for the most part, people are able to get pregnant on their own. They're able to grow
we
this
figured
human
out how to do
being.
that.
Yeah, good. You know, the body's able to create this life. Your body knows when to go into labor. But then suddenly the head comes out and you need somebody to put their hands on it and start twisting in order to help baby get out. Like the idea is just absurd that the body is so smart to create this life and bring this life into our arms.
But it can't get it
but
out
it
on
can't
its
get it
own.
out, right?
Yeah,
Like it just doesn't make any sense. Now, there are times,
But doesn't it make them able to meet their tea time better?
you know, I
that's
think,
a C-section.
I think
Oh, yeah,
part, well, you know, augmented labor is, I mean, you're talking about like 85% of labors are augmented with some sort of medication.
Well, my first.
Yeah, yeah. And the problem is that there are times when it works out well,
Sure.
but there are also times when it could be a big problem.
Are you, quick question, are you talking of, is this a blanket statement referring to things like Pitocin to induce, but also to epidurals and things like that, or?
There are no blanket statements.
Okay.
There are times when those medications are invaluable. There are times when they save lives. There are times when it's incredibly beneficial. But they are used way too often.
But when you say augmented labor, you mean anything that would alter the natural
Sure,
course of
you know,
delivery.
an induction. I mean, you can even talk about IV fluids are a form of augmented labor.
Okay.
External monitoring or internal monitoring where they screw the probe into baby's skull. These are things.
Sorry.
These are things that, for the most part, are way overused. Now, it doesn't mean that there's not a time and place for them. The problem is that we have this idea, again, that pregnancy and birth is a condition that needs to be managed or treated.
As opposed to
Like
a
you're sick
wonderful,
when you're in the
natural-
hospital and you're going to give birth. That's how it's,
Absolutely.
So crazy.
you know.
And here's the thing: is you're talking about the most natural, most beautiful experience that you know the basis for humanity, for life. And what we have is a system that views all of that as risk. And when you're operating from a place of risk, you're taking away that inherent trust in the body's ability to do things. Now, there are times when absolutely those things are invaluable. But for the most part, we use them way too often and we use them inappropriately, which actually creates more problems that then have to be managed or fixed. There was an article from the Wall Street Journal a few years ago that talked about hospitals make more money correcting their mistakes than they do from the primary treatment. And when we talk about birth, there's something called the cascade of intervention, where intervening leads to more intervention, which leads to more intervention. And I think too often people look back at their birth experiences and they might experience a level of trauma. You know, nobody should experience that, right? Everybody, regardless of how you birth or how you choose to birth, everybody deserves to be respected and feel empowered and feel confident and proud of their experience.
And look at it as a beautiful, wonderful thing they
Absolutely.
accomplished.
Whether baby comes out through the birth canal or when baby comes out through the abdomen, I don't care as long as that person feels empowered and respected in the process.
should, yeah.
Too often, we use medicine as a means of disempowering women, of taking away their rights, taking away their autonomy, taking away their choices. And I see people who are in labor who a doctor will come in and without even introducing themselves, stick their hand in their vagina and start doing a cervical exam.
Yeah.
I've seen women who are cut with an episiotomy even though they're begging the doctor not to. I've seen
That's
women.
crazy, man.
I've seen women who, through the fear of warning them that their baby is going to die, even though there's no objective,
We're pushed into a C-section.
are pushed into intervention that they don't want. Now, again, that's not all doctors, but it's enough of them that it makes the system really crumble, right? We have a healthcare system, and this is why, one of the reasons why we have such poor maternal and infant mortality rates. It's one of the reasons we have such poor satisfaction rates. It's one of the reasons, I mean, you look at South Florida, you have hospitals that pretty much from like 37 to 73% cesarean rate. Studies find that for-profit hospitals are far more likely to have a cesarean. Why? Right? Because there's money involved, and this is big business
And they're
also.
quick.
Right? Yeah, they're efficient, they're quick, they're easy, they're much. And listen, you have to understand, OBs are trained surgeons.
Yeah.
That's what they do, and that's not a bad thing. When you need surgery, you want a trained surgeon.
Exactly.
But OBs should not be the ones that are managing low-risk births. If you're thinking about, hey, how can we allow this parent and baby unit to make sure that we're protecting their safety, that we're giving them the best opportunity to have the experience that they want, that we're allowing nature to do as much as nature does, while still monitoring for complications, midwifery care is probably the single most underused intervention in all of healthcare.
100%. You're talking, so to clarify, you said midwifery care, but you mean have a midwife.
Having a midwife, because the thing is midwives are not trained surgeons. In fact, it's in their best interest to help you avoid surgery.
They're
Right.
trained to help you have an excellent delivery experience.
Well, I would tell you this: they're trained to protect the safety of parent and baby. They're not trained for your. That's why doulas exist. That's why childbirth education exists, because those things are much more about your experience. But your provider can get in the way of that.
Yeah.
Yeah.
And the thing is
we
midwives.
experienced that.
Yeah, midwives tend to be much more. They develop a better relationship with their patients. They tend to be more supportive of their choices. If at least the midwives that I work with tend to be much more encouraging of, all right, you want some more time? Okay, we'll come back and check on you. It's not that OBs can't be that. It's that most don't practice in that model. And there are some exceptions. There are some great OBs in our community who I refer to regularly. But for the most part, the default is intervention.
And that's how they're trained, though. And not to say that they're that those who practice medicine as an OB in a mechanical way are not culpable for the way they behave, but also they're taught to work like a machine.
Yeah, and I think part of the big problem is you talk to most OBs, they've never seen a really natural birth. They might have seen a vaginal birth.
That's really interesting.
But I'll give you an example. For our second birth, we were at home, and my wife was in a tub on her hands and knees, just breathing baby down. Baby came out. Benjamin had the cord wrapped around his neck 5 times. The midwife looked like she was lassoing a baby calf at a rodeo. And I immediately went right on my wife's chest. I was right there and immediately checked the spine to help deal with the trauma from the nuchal cord. And I sent it to an OB friend of mine from high school. And she said, "Oh my gosh, I've never seen anything like this." And I realized that when you're operating in that medical model, right? When you're operating from, medical school through residency into practice, you're seeing the vast majority of births are augmented with medicine, induction, Pitocin just in case, even, IV fluids. But the other stuff that's not is usually, all right, let's strap a monitor to you. Let's have you birth in the supine lithotomy position with you on your back with your legs in the air, which, by the way, is the worst position. Like, let me ask you a question. If you needed to take a crap,
I do that frequently.
right?
That's good, yeah.
You lay on your back with your knees up by your ears?
Never.
Right?
Never. Yeah.
First of all, it is probably one of the most dehumanizing positions,
Sure, yeah.
right? You have no power over your body.
When dogs are showing submission to an alpha dog, what do?
I mean,
Yeah.
it's a position that is designed for the efficiency and the comfort of the provider. If you were to design a position that would be counterproductive to every aspect of birth, it would be that position.
one we do all of them with.
Exactly.
Yeah.
If women had control and coordination of their body during birth, right? If they were able to choose a position that felt comfortable for them, the vast majority would choose being on their knees, like laying on a birthing ball, kind of in that sort of I don't want to say downward dog, but like yoga pose, like cat-cow, right, type of thing. You might see people who give birth in a squatting position. You might see people who give birth on their side. There's all sorts of positions that facilitate a smoother delivery, but most people don't even know it's a choice. Because providers...
Definitely not given.
No, it's not given as an option.
And they'll push you away from it.
And you have to fight for it, right? And the one thing I'll say is if anybody gets anything out of this talk, I think the best position to labor in is the toilet. Here's why. It's a perfect... it allows you to use gravity, right? It helps... that squatting position helps open up the pelvis. But it's also the only place in your life that you've really learned to relax your pelvic floor.
That's so interesting.
It's psychological.
Yeah. If you're in, listen, go up to your bed, right? And try to pass a bowel movement in your bed. Even if you wanted to, you're going to have a psychologically difficult time relaxing your body to do it because it feels wrong. Now, have all of that pressure while amniotic fluid's coming out, while blood's coming out, while feces is coming out, right?
And you're anxious about your life and the life of the baby.
And doing that in a bed setting. It feels completely unnatural. But you go into a toilet, it feels, all right, yeah, amniotic fluid's coming out. But you know what? I'm in a place that it feels appropriate to do it. Right? Wow, I have pressure, rectal pressure. Is it poop or is it baby? Well, reach down. Do you feel baby's head? No. Okay, so then it's poop. Just go and flush.
Right.
It's a position that feels much more natural, and it's a position that facilitates proper biomechanics in birth.
And then when baby is out in that position, the mother would catch baby and pull baby up?
You can. I mean, listen, I've had moms in my practice who give birth on all fours, and they just reach down and they grab baby's head, and baby never even touches the bed. They just pick him right up and bring him right to their chest.
Right.
I've had other moms where a partner is there to support the head and help protect them while, the baby's coming out. I've also had some times when mom's on all four and it happens so quickly that baby just falls down into the bed, right? Like, the
Which
thing
probably
is...
happened for thousands of years, and the baby was fine.
Yeah, I mean, here's the part of the problem, and this goes, you mentioned thousands of years. There was an institutional knowledge that was passed down from generation to generation. Women used to give birth...
This is a passion point of mine, man.
Yeah.
Actually. Yeah, 100%.
Right? Women used to give birth in communities where all of the women would get together and support one another, where little girls would grow up seeing birth as a normal, natural process and seeing breastfeeding as a normal, natural process. And there wasn't this fear and pressure and anxiety. What choice should I make? Well, you have the one choice of giving birth, right? Baby's going to come out.
But after the Industrial Revolution...
Birth was taken from midwives, right? From lay midwives, people who have done this for decades without any formal training. And suddenly it was a medical procedure. And this is when we get into the realm of twilight births, where women were knocked out with drugs and given straitjackets for days at a time. We're talking about all sorts of intervention that you look back on, and you're like, wow, that was a really bright, shining light in medicine's history. But what we still view medicine with the same sort of pathology. We still view, birth through the same light of pathology. We still see it as something that needs to be managed. What we should be doing is honoring the inherent wisdom that exists in that birth process and monitor and screen women to see if they need other intervention when it's appropriate.
Because if you go to traditional cultures, and there is a point to be made about life expectancy, infant mortality. Like, those are important discussions to be had.
Absolutely.
And medical intervention helps with that.
So let's talk about how the U.S. is on second to last in both of those.
Right.
Right? Here's the thing. We can talk about how medical intervention can save lives, but we also have to talk about how medical intervention can disrupt life.
Yes.
Because there are other countries that do not have the systems in place for pregnancy and birth that have much better maternal mortality and infant mortality rates, that are much less expensive, that honor the birth process.
That don't dissuade women from attempting even to breastfeed.
Listen, I can't begin to tell you how many women come to see us in our practice who are terrified because their doctor made one comment. Wow, you have a really small pelvis. Oh, wow, your baby is really big. Well, first of all, none of that tells you anything about what birth is going to be. right?
Because this woman's skinny, but she can push some babies out, bro. Like for real. Like a boss.
Well, and I know people smaller than me that have had 8-pound babies, all natural.
I've had moms in my practice who tell me in previous pregnancies, 6 foot tall, really wide built women who struggle to get a 5-pound baby out. And I've had tiny little 4'11" moms, the size of a pencil, push out 10-pound babies. Wow. It's not about the size of mom or the size of baby. It's about the performance of the pelvis. Because a goldfish doesn't outgrow its bowl. Right? You're not going to have a goldfish and say, oh, it's in a small bowl. Wow, it's massive. Look how big it is.
And yet we kind of anticipate
No,
we would.
because here's the thing. That goldfish is going to adapt to its environment.
Right.
It's going to grow to its ability based on the environment. You're not going to take a goldfish and suddenly have it be massive in a bowl that can't support it, because our body, our development is limited by the environment in which we place it.
So if you get a woman in the hospital and she's got, let's say, an 8-pound, 6-ounce baby, and she's of slight stature, and labor is stalled and she's at 7 centimeters for 12 hours, how fast do you think they're going to the surgery to
Here's the problem, because
I'm not saying this should. I'm asking
because you already, even from the conversation, the question, you started all the way 10 steps in.
Okay, that's important.
The premise that this mom needed to be induced, or the premise that this baby's too big for her body, it starts with the fundamental belief that women are not capable. And we have a problem in our society where we think that, and we basically indoctrinate women to believe that their bodies are not good enough.
Is that in our hyper-feminized society where we want to empower women, we do that?
Well, here's the thing is that, whether it's beauty standards, whether it's social media standards, whether it's healthcare, right? You can look at it time and time again how women are assumed to be weak and unable, right? And so we look at birth and we say, you're really small. Right? You have small pelvis, you're going to have a hard time giving birth. Oh, you have childbearing hips.
And
That's
sometimes
great.
people say that flippantly, not even realizing
they don't
the
think
effect that it
anything
can
of it.
have.
The stupid stuff that people say, thinking that they're helping, right? Like, I'll give you a great example. I had a mom who came into my practice yesterday, and she's pregnant with her second. Now, 2 months ago, she was diagnosed with Hashimoto's, an autoimmune condition of the thyroid. The day she was diagnosed, the nurse says to her, "Oh, too bad." She goes, "What do you mean?" Because, well, you're going to have a really hard time getting pregnant now. Like,
Wow.
Where'd your ball come from?
mind you, like 6 weeks later, she gets pregnant, no problem.
Right,
like,
of course.
the assumption that your body is not capable or not good enough has led women to give up all power in the context of birth, because they just, and again, do you want to kill your baby? Right. That's the question that's asked whenever women try to institute their own power and say, this is what I want. Really? You're going to give that up for the life of your child?
And they completely, and not to get way off the rails here, man, but when we were in the hospital with Benjamin, our first, she's induced because there's a pinprick leak of amniotic fluid, okay? Yeah. And they're like, oh, it's not safe. Okay, but she's fine.
Well, yeah, because, they were like, well, it's been 24 hours. You've not started labor. We need to induce you.
Yeah.
Risk of infection is high.
And so they induce.
Well, hold on. Why is the risk of infection higher? Because they're shoving their hand up your vagina, checking to see if you're dilated.
Which I think we stopped until then. Until they identified the leak, we didn't want any internal monitoring at all.
Well, they didn't. Well, as far as like checking, yeah.
But that's what increases the risk.
Yeah.
Right?
Yeah.
It's not, listen, the genitourinary system is a complete
It's a self-cleaning
self-contained
system.
It's an right. They warn people now, right? Like, don't douche because your body does cleans things naturally.
I've never even tried.
Well, I'm relieved to hear that. But we fundamentally assume that there's something flawed with your body, and this is honestly, I mean, we're going way off the rails here.
Man.
The eye ointment that they give to babies.
We didn't do it.
Yeah, why? It's the assumption.
It's not necessary.
The assumption that mom has chlamydia or gonorrhea.
Right. And if mom doesn't,
well, here's the thing: we don't care if mom doesn't now, because she might go out and contract it. It's and again, this is where comes the disempowering of women during the birth process, because even when you look at the hepatitis B vaccine in kids, and we're not having a vaccine conversation, but there's certain vaccines that, hepatitis B was introduced to protect healthcare professionals working in populations that were more likely to contract hepatitis B. Yeah. In the 90s, it was given to medical residents working in underserved populations where drug use and prostitution is a problem. The populations that primarily get hepatitis B. Well, now we give it to every baby. Why? They're not shooting up drugs between nursery stays, right? But the assumption is that mom may have hepatitis B or may contract hepatitis B. Instead of assessing their lifestyle and determining, does this really make sense for this individual? We have a one size fits all and says, let's give it to everybody because we don't trust women as an industry.
I've never been vaccinated for yellow fever. Do you know why?
Because you've never been in a place that would be exposed.
Correct.
What a concept.
Right. I mean, I think there's a lot of money involved in that. You know what I mean? I think there's...
Well, so not to get too crazy. In 1986, Reagan signed the National Childhood Vaccine Injury Act.
Okay.
And what that did was it granted immunity to vaccine manufacturers.
Yes.
And in the process of doing so, it basically opened the floodgates. Because before that, you had measles, you had diphtheria, pertussis, you had diseases that, while we can have a conversation about in an industrialized nation if they're really as dangerous as we
They
pretend
did
to
kill
claim
kids.
they are, they were problematic,
Yes,
right?
yeah.
Especially, decades earlier. But when you think about something like hepatitis B, and you realize that
Kids don't get hepatitis B.
after the Vaccine Injury Act was signed, now all of a sudden vaccine manufacturers can say, if we can produce vaccines that are approved by the CDC and are put on the the childhood schedule by the Advisory Committee on Immunization Practices, if we can do this, now we have a new stream of money that doesn't have any risk to us. Whether or not it's necessary. And I'll give you a great example, right? The rotavirus vaccine. Studies show that in breastfed babies, there's really no benefit to the vaccine because mom's breast milk confers immunity for those first 6 months. And after 6 months, you can no longer administer the vaccine. And so what happens is we're saying, let's protect baby. Now, mind you, as long as you can keep kids hydrated, it's a self-limiting disease. It's not something that you really need to worry about. The main problem is dehydration. But we're going to give it to everybody because instead of assessing the risk factors of this child, listen, if you're staying at home and if you are a breastfed baby, there's really very little reason to worry about rotavirus as a common cause, especially in an industrialized nation where, God forbid, your child needed it, you can go get IV fluids. But we're just going to give it to everybody, all right? It's the assumption that there's a one-size-fits-all approach. And this is when you said about blanket statements. There are no blanket statements in healthcare. I can't be here and tell anybody, this is how you should live your life. These are the choices you should make. And I think medicine gets in trouble when they try to do the same thing, right? Everybody should get this intervention, right? I've heard perinatologists say every mom should give birth by 39 weeks. I've heard pediatricians say every child should receive this procedure. The problem is that there's nothing about life that's a one-size-fits-all. And we need to look at our families as individual organisms, individual units that may have different needs than other people. And that doesn't mean that the decisions you make for your family is wrong. It just means that your decisions, as long as they're coming from a place that's philosophically sound, congruent, educationally based, right? That might be the right decision for your family. We need to honor that and honor the choices that families can make. And I think, unfortunately, we have a healthcare system that is very much about trying to control and trying to fit everybody in a small box, that box just can't possibly fit everybody who they're trying to put in it.
And I think that's, like, everything you're talking about makes me appreciate you. And that's why I'm so glad that I, started going to, what now, 6 years, 6.5, 7 years ago. Because it's not just one thing. You're constantly educating and encouraging your patients to look at other areas, to be healthier in other areas, not just in helping to align their spine, either to fix pain or to help keep them healthy or, to fix other things that those nerves are connected to. So what makes the way you practice chiropractic versus maybe some other chiropractors, what's different? And I really want to make sure people that are watching can find somebody in their area that can help them if they're not local.
It's hard because you go to 100 different chiropractors, you get 100 different things. I think that there's nothing special about my application of chiropractic. I think it's the recognition, the understanding, the way I've tried to practice the foundational principles of the profession. The idea that I'm not trying to treat a condition. I'm simply trying to restore normal function so the body can heal itself. And that, yeah, there's some things that you can do on your own in your lifestyle that can facilitate that are important. I wish I could tell people that there was a simple website to look up and, or a simple, certification, but there's really not. The primary resource that I would tell people to visit is the International Chiropractic Pediatric Association. It's the letters ICPA, the number 4, kids.com.
We'll include that in the description of this.
And you can search by your zip code and find somebody who at least is a member of an organization that believes in these foundational principles. The idea that the body has the ability to heal. That the nervous system facilitates that healing, and when it's working properly, the body works properly. That the spine, as a result of trauma throughout life, can have misalignments that disrupt that nervous system, contributing to dysfunction and dis-ease. And that by adjusting the spine, we can facilitate better function throughout the body, right? That's what chiropractic is if we had to boil it down to 4 points. The ICPA is going to be a resource where you're going to find, more likely to find those providers. Okay. The next thing I would do is check out their websites, call and ask for a consultation, find out more about how they practice, right? Do they have an objective criteria for knowing when to adjust and when not to adjust? Or are they just indiscriminately adjusting the same thing every single visit? Do they have a way of monitoring your progress visit to visit and over time? Are they giving you recommendations on things that you can do at home to help minimize the stresses that cause chiropractic to be needed, right? These are the things that you want to kind of talk to them about. And here's the thing. We have a problem where if you have a bad experience with a medical doctor, you find another medical doctor. If you have a bad experience with a chiropractor, you think chiropractic is crazy.
Yeah.
What we need to do is recognize that just because the chiropractor that you saw may not be the right fit for you doesn't mean the perfect one isn't down the street.
We see this in church world a lot too.
Yeah.
People go, oh, I had a really bad experience in church. Well, yeah, so have I. But we don't do this thing where, have you ever eaten at Taco Bell before? You've eaten at Taco Bell. Okay, so therefore you've had diarrhea, right?
Of course.
Right, okay. But you didn't go, you know what, since I had diarrhea at Taco Bell, I'm never going to a different restaurant ever.
Correct.
Right. Logically, it doesn't follow. So I like the way you're saying that. Now, if I were to go to you, Joe Schmo off the street comes to you as a chiropractor and asks about the things you just told us to check on, is that chiropractor going to be receptive to that? What kind of red flags in the way they respond to you? And obviously, we should come with respect and not be a
Sure. I mean, listen, if a chiropractor or if any healthcare provider is unwilling to answer questions, find another healthcare provider.
Love that.
If you go to see an OB and you're asking about your pregnancy and your options, and the OB says, yeah, everybody with a birth plan has a C-section, that's a huge red flag that OB is not there to support you, right? If you're ever made to, if you ask a pediatrician about a vaccine or a medical intervention and your pediatrician mocks you or dismisses you without genuinely addressing your concerns, find another pediatrician. You deserve to be an informed consumer of healthcare. And you deserve the right to be able to say, no, this isn't what I want, or I want to make sure that this is what I want before I start investing my time and money and energy in coming and seeing you. So if you get pushback, oh, listen, you just need to trust me. No, I don't. See you later. They should be excited to answer these questions. They should be excited at the fact that you're understanding of the profession enough to ask them. Right? We should celebrate that. And guess what? If they're getting angry or frustrated, it probably means they don't have the right answers. And they're probably not the right practice for you.
So if someone's in...
I think that carries for all providers.
Everything. I mean, listen, if I went to you as a religious advisor and I asked you, well, what's the meaning of life, right?
Yeah,
and
that's going to be a long conversation, bro. Yeah.
Sure, but you're willing to have the conversation.
I would love to have that conversation.
Exactly.
It's something I'm passionate about. Yeah.
If you in turn said, you just have to come to church and find out.
Yeah.
Yeah,
That's an excellent point,
you just
man.
have
That's
to,
really
you just
good.
have to tithe more. No, sorry.
That's so good.
So-
I love that.
So, like, you want to find people who are not going to, I think, unfortunately, previous generations have a very authoritarian paternalism relationship with healthcare providers.
And they rely on an appeal to authority as
Absolutely.
a logical argument, which is a fallacy.
I'm the learned professional.
Yes. Yeah.
I'm wearing
Therefore,
my white
you're
coat.
perfect.
And the reality is, those learned professionals are also humans with their own biases and their own beliefs and their own flaws and their own egos, and they should be willing to have conversations. I love it when people come in and try to challenge me with a question.
Yeah,
and
that's good.
Oh, I bet you loved him.
Yeah,
I did. I think I didn't that bad.
I thoroughly enjoyed it because you know what? I love skeptics. Skeptics are different than cynics.
Because it means they care.
There are people who, I'll give you an example. I've had a couple posts on Facebook that have gone, viral for me. Okay. And I get a lot of people who either have never heard of pediatric chiropractic or simply just think it's quackery. Yeah. And some of them will say, I don't understand what you're doing here. Why would you? And I will spend as much time as necessary and provide as many links to people to explain what we're doing and let them understand. Mm-hmm. But I also have people who say, this is BS, you should be in prison. Oh. I'm just gonna delete you and move on, because why am I gonna waste my time with somebody who's clearly already made up their mind and refused to be even open? So I don't ask any of my patients to come in, quote unquote, believing in chiropractic. I think that's a myth. Like, you don't believe in gravity. Gravity exists whether you believe in it or not.
I don't go to rheumatologists trusting them. So
no. But the principles of chiropractic, Sid Williams, the founder of Life University, used to drop keys, and he says as consistently as these keys are going to fall to the ground, chiropractic is going to work. It's just a matter of what we determine as work, right? Too many of us think about it in terms of like a symptomatic relief instead of facilitation of better function. But I appreciate people who come in with questions and skepticism. I don't appreciate people who come in completely made up their mind and willing to sacrifice the health of them and their children in order to be right. I have had dads refuse to even talk to me about chiropractic for their child and instead opt to surgically sever the muscle in their child's neck because they were afraid that an adjustment might be too harsh on them.
Weird question, like a trap or sternocleidomastoid or what was?
Yeah, they had a child had torticollis, and they tried Botox. Yeah. And I kept telling them, listen, chiropractic can address this, right? Like chiropractic can really support your child, and ultimately they opted for surgery where they severed the SCM, and like how committed to being right. While simultaneously being wrong, do you have to be in order to sacrifice the long-term health of your child in order to simply refuse to try chiropractic? So there's a difference. If you go into a chiropractor's office and you have a genuine curiosity and a healthy skepticism, that's fine, right? Let that chiropractor.
And we don't have to agree in the end either. Like,
no, listen. There are people who come in and say, you know what? I think what you're saying is interesting. I just don't want to do it. Cool.
Yeah, but they're not coming and throwing insults and being a turd.
No, listen, go be a turd somewhere else.
We have this on YouTube. We've got these people, most people, 99% are super kind and they're encouraging. And then somebody comes in and says, hey, I think you're just in it for the money. Well, that's awesome. We don't make any money off of this right now, right? Mm-hmm. But a little bit. But we would let that get into our heads. But I think what you're saying is so important. And really for any discipline, for anybody's profession, for whatever you do, the people who are your detractors and they're not interested in conversation, they're only interested in ad hominem attacks and insults and just whatever. They haven't earned your time.
No.
And so do you run up against those folks?
All the time. I mean, mostly online, right? Like it's
the trolls.
We're well aware of as a society that people act differently online than they do in person. Oh. Most of the time, if somebody believes those things in person, they're not even going to come in and talk with me.
No, which is the right thing to do, probably.
And you know what? That's fine. I mean, listen, I personally think that having a healthy sense of curiosity is valuable, especially when it comes to the body, which we're still discovering things about, to this day.
We just realized the mesentery is an organ. Look at that.
Yeah, just the idea that there's anything extra or unnecessary in the body is just absolutely absurd. People talk about even the coccyx is a vestigial, trace of a tail.
Yeah, but when you break it, it hurts.
Your spinal cord attaches to it.
Yeah, but
right?
we just cut it off.
gosh, or like, listen, we have a whole generation where we took out their appendix and took out their tonsils, and now we wonder why we have colon cancer and throat and lung and anyway. There's no unnecessary parts of the body, right? The question is, how do we make that ecosystem work better? And I think this applies whether, when we talk about physical, mental, emotional, spiritual, it's all together. It's, when we took even from a holistic principle, not holistic, like naturally I'm going to wave crystals over you, but like holistic from we're looking at the whole organism as one. Yes. That whole organism as one embodies everything that's in it and everything that it is in terms of its relationship to the world around us. Mm-hmm. You cannot put a body in a toxic environment and expect it to be healthy. You can't put it into a house that's filled with lead paint or mold or crazy amounts of dust and feed it toxic food and give it toxic, chemicals throughout its life and expect that body to be the best version of itself. Yeah. Right? When the Great Lakes were toxic and the fish were dying, they didn't say, let's pour in medicine. What they said was, let's clean up the environment. Let's get the waters to be healthier. And in doing so, the living population within its environment will be healthier. We have a fundamental problem where we're trying to use more and more toxic things, whether it's, electromagnetic frequencies or whether it's, chemical medications or whether it's, food additives, like all of these things to try to make life more convenient. Well, the problem is we're creating a more toxic world for our children. And that's one of the reasons why we see kids have more and more chronic illness than ever before. And the only way to change that is to change the environment, both externally and internally. Chiropractic will allow the body to better adapt to the environment, but you ultimately need to focus on creating a healthier environment.
I would love to go down about 12 different rabbit holes with you. Like, sincerely, there are so many things I think we could just, go on a spiel about for a while. But I want to honor your time, man. And so important, how can people find you if they're in South Florida or feel like flying to South Florida?
I would say first and foremost, definitely look at the ICPA website. It's a great resource to find chiropractors near you. I would love to tell you that there's something special about me, but there are plenty of other amazing chiropractors all throughout the world that can deliver just as amazing chiropractic care as anybody else. My website is welladjustedfamily.com, and I really appreciate the opportunity to be here. And I think we were planning on 45 minutes, and I think we're running on 2 hours almost.
We're getting close, man.
And so,
awesome.
I would love to come back and expand on some of these things, because as I warned you before, you put a microphone in front of my face, and I'll just keep talking.
I honestly have enjoyed it immensely, and
Same.
I would love to have you back. Sincerely, I think there's a lot we can get into. In a lot of areas.
Yeah,
awesome.
For sure. We're so glad you came.
And maybe we can just have a whole session just of me responding to the angry comments on the video.
I think we can do like Dr. Shtulman reads mean tweets kind of thing. Really
Perfect.
Good. Yeah.
Perfect.
All right. Thanks for coming, man.
Ask me anything. Yeah.
All right.